I'd like to welcome everybody to our third class on living with diabetes, and tonight is a very important topic. We're going to talk about how can you and I avoid the complications of diabetes, and I think there's not a person in this room that would like to avoid every single one. We're going to go over that, and then what signs to look for if things are beginning to change in your body that you would definitely want to know about and do something about. I'm going to ask you to go to your handout. We're going to have some slides that are behind me as well. I'll try to answer as many questions as we go. Then we'll have a time of Q&A at the end of our program. These are the type of things I would ask. What symptoms do I need to watch for? How do I know if my glucose is too high or too low? You're going to know for sure what it looks like, what it feels like when your sugar gets high and low. Some of you have a family member that came with you tonight. They need to know that too. So when you are acting a certain way or behaving a certain way or looking a certain way, they will know what they need to do. What can I do to stay healthy? There's not a person here I bet would like to say, I'd like to keep both my legs. I'd like for my eyes to stay strong and healthy as long as they can. I like for my kidneys to stay healthy and not have to be on dialysis, and on and on. Am I right? And so to do that, there are some real specific things we can do. So let's look at, this is Leonard Thompson. 1922 was the first diabetes that was treated with insulin. Now, if you were looking at a slide, you're going to see someone that had lost so much weight. Type 1 diabetics often will have this enormous weight loss. Now, it's a little different for type 2, but on type 1, when they do that, and that boy would have died if they had not started, and he was the first one. Of course, his mom and dad, I'm sure, was wits end. And then there's another case. It was a younger girl who would have died, they said, within days if had not been treated with insulin. So it's only been in the last 100 years that we've learned what is insulin, what can we do with it, what are other medications, what medications are being rolled out, how will it work for me. So the first thing I'm going to ask you, and we'll go over real quickly, is what is evidence? Now, most of you will know this one because many of you already have the diagnosis of diabetes and experience some of these symptoms. But what are symptoms for hyperglycemia? Hyper meaning high, hypo meaning low. So what are symptoms? Increased urination, and you might think, have I been drinking that much? But you'll be going and urinate, sometimes at night especially, but increased urination. Increased thirst, losing weight without trying. Those two slides I showed you, those were two people that had lost weight. They weren't trying to lose weight, but had lost a significant amount of weight. Increased hunger, the vision starts to change. When you get in that 200 plus, 300 plus on your glucose, you'll notice and you'll just go, things aren't quite, I need to go back to the eye doctor. I need to get my glasses changed again. You'll notice changes in your vision. Things are blurry. And then you'll notice as well just being tireder than usual. You'll say, I'm getting a year older. Haven't we all used excuses, those of you as we are getting beyond 40? Getting a little older. Maybe that's the reason that I'm getting tired so easily. What would happen if you choose not to treat the high glucose? Some people do not want the diagnosis. They'll fight it. And what would be the reason that you need to address it and try to get on top of it early? You'll look at several complications. Coronary artery disease will kill you. And so that's years ago we called it hardening of the arteries, but we know from that, once our arteries begin to be harder, begin to thin, then we're more apt to have a heart attack, we're more apt to have a stroke, we're more apt to have kidney disease, because all of those arteries are supplying the blood flow to major organs. I have to have that oxygen carried by the blood to my brain, or I will not be as sharp as I need to be. I'll be drowsy, I'll be fuzzy. I have to have it to my heart. I have to have it to my kidneys. It's so important that we keep that viable and important. And then there's a list. I'm not going to go through and spend too much time on this because in your handout I have copied articles for you. But cerebral vascular disease, that's when it's more apt to have a stroke. Peripheral vascular disease, oh, my legs are hurting. They get tired easy. I'm starting to notice some changes. You may have said some of those type of things. I'm noticing my feet feel differently. There seem to be a little tingling. You may have said some things like that. A kidney failure, poor vision, acuity. And again, to the point the doctor goes, I don't know really what else we can do. If you are diabetic and your sugar is not controlled well, you're going to develop cataracts much earlier than your counterpart would. It will really speed up the development of cataracts. You'll notice as your neuropathy may kick in, you'll find that fine motor skills be more challenging, such as picking up a coin or a pen, or you'll notice changes like that. Gingivitis. Okay, we're going to talk a moment about oral care in just a minute. Chronic constipation. And people thought, I thought maybe it was just I was less active or not drinking enough water. You will find this as the sugar stays high. Urinary incontinence, and then orthostatic hypotension. Any of these can be troublesome in your lifestyle. So what can we do about it? Now, I want to spend just a moment. The normal eye with a diabetic retinopathy, there's going to be a problem because you'll have these little blood vessels that will burst, and then this has to be treated, and you'll have hemorrhages, and then they'll develop a macular edema. This is something that needs attention quick. And can it be treated? Absolutely. But this is something you don't sit at home and go, well, I don't need to do anything about this. So when you notice those visual changes, do something. Now, there's another one that's very, very important. And when we look with diabetic retinopathy, if you see spotting, and I try to put pictures up that would show you what you might notice as a change. And so with the camera, if you can kind of show this a little bit for the video, but you'll see some dots come up. Don't try to blink these away. These are things that if you notice them and they're staying there, this is not floaters. A lot of people have had the doctor say, have you had floaters? As our cholesterol gets a little bit higher, as we age a little bit more, we'll actually have breakaway and have these little floaters. This is not that. This is actually where it'll take some space, and you'll notice your vision field has been compromised. So it's going to be really important that you go in and get an eye exam. If you have the cataract, boy, they're doing some fancy stuff now with removing the cataract and then actually correcting your vision with a lens. So they can do some stuff. Just don't wait. And again, glaucoma is pressure, and that's something, again, you'd want to get on top of, and there's treatments for. What if I wait too late? I can have some complications that I can't back up on. So it's real important when you have those visual changes. This is due to pressure, and with the pressure, it can damage the optic nerve. Now, once we get back to that point, it's hard to backtrack. So when you see the changes, and a lot of times they may give you drops. Some of you may be on drops for your eyes already, but they may give you drops to try to counter that. We're going to start, let's go head to toe. I'm going to go through this quickly. I talked about gingivitis. You can start getting, there'll be inflammation in the mouth. They can develop infection in the mouth. You can start having problems with your gums. You can then develop even a fungal, thrush is just a fungal thing on your tongue. And you can get extremely dry mouth. Now, some of this you can lose teeth over, especially when you get the periodontal disease. So it's very important that you keep up with the dentist. Twice a year go for cleaning. How many times should I brush a day? At least twice. How many times should I floss a day? Now, what the Diabetic Association says at least once. Some people really start flossing more than that. But y'all just ask yourself, are you flossing at least once a day? Or are you brushing your teeth at least once a day? It's going to be very, very important for the oral health. Keep your original teeth as long as you can, okay? The vascular disease I've already mentioned, the issues of stroke, heart attack, and kidney disease and peripheral artery disease. People who have diabetes and do not keep it under, the term I'm going to use is tight control. You would rather keep it really tight. Now, if a doctor lets it bounce up high, and we will talk about numbers, then that's not tight control. You want it under tight control. You'll be the one that has very little or diminished complications. That's what you and I want. So keep your glucose under tight control. When it is not, you're going to be more prone to some of these catastrophic diseases that could kill you. I have handouts for you in there that will deal with eye exams. Most people, as they progress in their diabetes, will go twice a year to have their eyes checked. And they're looking for changes. The eye specialist is looking, have you developed diabetic retinopathy? Do you have macular changes? And they're looking for that so they can treat them quickly. But if it's still halfway between your 6-month visit and there's visual changes, should you make a phone call? Should you make a visit? Absolutely. You are responsible at the first sign of changes to go in and make changes. Same with your teeth. If you're noticing that your gums are bleeding more, if they're receding down more, and look in the mirror. Look at your gums. See how they're reacting. If not, you might have some teeth that will go missing. Then we'll go on with the with some of the things we can do about that. Now, with heart disease and diabetes, 55% of those that have died has been because there was a cardiovascular problem. A diabetic will rarely die of a complication with diabetic retinopathy. They're going to die more often with a vessel problem. Heart disease occurs in an earlier age and usually will, as you develop more years with diabetes, it masks some of your symptoms of heart disease. Meaning, I had a nurse that was a friend that was a diabetic, and she would often have discomfort, but it was nothing like you would think of having a heart attack. And it was masked. Some diabetics will not have pain. What would be for someone not a diabetic, they would be going, boy, I'm having retching pain. Some of them, it's masked. So when the pain is felt, it's a really big issue going on. So be aware with stroke, you got to be really conscious of your symptoms. And when you have something that, y'all know the symptoms of a heart attack. A high percentage will have a crushing pain in their chest. It may be burning, may be stabbing, it may be something that feels like tightness, but there is a percentage, often diabetics, that the pain may be somewhere else. They may have it in their back. They may have it in their jaw. They may have it in their neck. So it could be in a different place. Just be aware of the panel of the area that you can have pain and it still be related to your heart. We had, we had one lady, and she came into the emergency room. She said, my back is killing me. And then after a few minutes of rest, it seemed to be better. What were you doing? I was moving a couch. Now, she was in her 60s, and she was moving the couch by herself. And so they thought, well, maybe she pulled a muscle or something. But when they hooked her up to the EKG, we're looking at the electrical activity of the heart. When they hooked her up, it showed that she was having a cardiac event. Why was the pain in her back and not her chest? Now, eventually, after she was we wanted to see if we could reproduce that pain. So we put her on a treadmill. And as she walked, where do you think she started hurting? In her back. So typically, people that are going to have angina or heart pain, it's going to be in the front, but she had it in her back. So just be aware. All of this, I'm telling you, is just to know that diabetics sometimes can fool you with their symptoms, okay? I've had 2 or 3 women that had jaw pain. I've had women that would complain of more of indigestion, a little bit different place, epigastric rather than right in the middle of their chest. So again, women can be a little different with diabetes. So let's be aware of all of that. Now, we're going to go over a little bit later, but I'm going to mention foot care. I'm going to talk about what needs to be looked for. Why would we spend so much time on feet for diabetics? Because the biggest complication, other than what we see that can be catastrophic, like the heart and the kidneys, is going to be that we develop a wound. And a wound that does not heal, what does that mean? By definition, if you have a wound, and it could be very small, that does not totally heal in 3 weeks, that's a non-healing wound. Now, you kind of remember that. So when you see something around your feet, or even as a diabetic, if you notice it other places, you keep a kind of a date time on it of how long has it taken for that to heal. And more than 3 weeks is considered a non-healing wound. That's a problem, and it's seen more with diabetics. So we're going to talk more about that, skin issues, and then what does it mean for neuropathy to develop. So let's take a look first at what should I do with my feet. And I'm not going to judge you what you're already doing with your feet. We'll talk more about that after our class time. But you should wash your feet how often? How often do you think? Don't shock me. Every day. If you were thinking something else, you need to revisit that. You need to wash your feet every day. One reason is to take a good look at them. Now, I am very aware that we're all shapes in here. And there may be someone, and I'm being as sensitive as I can be, that cannot get to the bottom of their feet. Okay? But you need to find some way that your feet can be washed and examined every day. There are mirrors that are made that you can actually get, and has a little curve on it that you can put down and look, and it may not be your size as much as anatomically. You may have orthopedic issues where you can't bend. So you need to be able to have someone, if not yourself, look at the bottom of your feet and in between your toes. So we'll look at the example that we need to wash feet every day, and it's going to look similar to this. I'm going to jump over to a bigger picture of what you might be able to see. So if you look at the bottom of your feet, you're looking for several things. If you're sitting, you can examine your feet. If you are not able to sit, put your foot up. I'm not asking you to do that now. And to look at your bottom of feet, that is when you need to have someone that you ask. You can be laying down or whatever to have look at them, look at the bottom of feet. And where do they look on your feet? If I were to have you, I'm going to play the role of your doctor right now. May I do that? Okay, this is what I'd want you to do. I would ask you to lie down. I would look at both of your legs. Is one leg larger than the other? Now, they can be an inch or two larger and it not look that way. If it visibly looks larger, that's usually an issue. And I'm looking particularly in the calves. Do they look different? Is one shinier than the other? I'm going to look for skin changes. Are they very dry? Diabetics, as their sugar stays high, their skin gets very, very dry. So now, on your handout, go ahead and find this sheet in your handout. And so, are you having trouble with skin? There are some wonderful lotions that you can do for your skin. Are they discolored in some areas? So as you look at your legs, do you notice that the color's not uniform? There's spots that look different in color. Do you find you develop calluses easily? Maybe not just on your feet, but on your hands as well. Are you someone that develops calluses? How do you deal with those calluses? You cannot shave them. Get the knife and crack. We're going to talk over that, how best to work with that. A fissure. Now, what would that be? That might be perhaps you've let your feet get so dry and so hard, and you haven't given attention to them, that they've gotten hard almost like leather, particularly around the heels and the side, and then from that, they will have a crack develop. Now that's dangerous for a diabetic, because in that crack there can be an infection and a wound develops that has trouble healing. So if we reverse that and go all the way back up, my skin is dry, it hasn't gotten calloused yet, it hasn't gotten to the point it's like leather, it hasn't cracked, then we're in pretty good shape. There will be things like, some of you have seen the little buffers. They're not very abrasive to the skin, but they will literally get calloused areas and just sand it. Look out, because it's going to fly everywhere. I use one of those on my feet. I'm not a diabetic, but I use it on my feet, and it really keeps the heels like a teenager rather than, because as we age, it's going to be getting tough. So give attention. If you look at your feet and see if there's any calloused areas. Look and see if there's any wounds and give attention to those. Other things that the doctor may look at is from the ankle up, are you noticing a hair pattern changing, that you're less hair? And you go, oh, I'm just getting older. But if the vascular flow is diminished there, it's a good indicator. So if I were looking at your legs, I would look and see if it looks like there's less hair than typical for someone your age or your sex. Usually men have, of course, more than women, because women would shave. I would look for redness, and particularly the redness or the beginning of an ulcer, whether it be more of an arterial problem or a venous problem. Then I'd get down, I'd look at your toes. And on your toes, diabetics are going to be more prone to have a fungal infection. The thickening, the brittle toenails, and that it's aggravating. Can they be treated? Yes, they can. It takes more than a week. But fungus in the toenails is very common with diabetics that keep their sugar up too high. So I'd look at your nails. I'd look and see if they have become really elongated. I've had some diabetics when I was still working in the hospital that got so long they began to curl over the toe. That's dangerous. It's hard to cut them, and then you're getting into a whole different issue. So are the nails elongated? And then macerations, and I'm going to have a picture of that in a minute, and that's going to be between the toes where there are changes. An ulcer can be hiding between your toes. Now, you literally could get in the shower, get out, and never look at your feet. I know. I've done that. Got in the shower, whoo, and then off to work I go, and really not give, and there could be something going on that I do not feel. So that's the danger. So how often should I wash my feet? Every day. How often should I look at them? Every single day. There's also some things that will be deformities. So I'm going to stop with this part, and I'm going to run through this real quick and then go back to some things you to look for. So you're looking at the bottom of your feet. Those of you can. When you've washed your feet, now of course, she's in a jumpsuit out of modesty, but if she was drying her feet, she want to make sure to dry well in between her toes. Oh, the stinker of the areas that break down between the toes. So make sure they're dry between the toes. And then she had a little trouble bending over, so she got a little mirror. It's all kinds of devices to get. And then you can feel your feet. Now, we're going to review about this monofilament, how you can have someone help you to see if there's been neurovascular changes in your feet. Neurological, that wouldn't affect your feet, would it? And then you're going to look carefully, if you can, both feet side by side as you check your toes. And then as your shoes, when you put on a pair of shoes, and I have told people this for years, you need to get your shoe and put your hand inside, because often people have put on a shoe and they didn't realize a piece of the fabric inside had just come unglued. Now you would think, well, why that? But 8 hours of walking on that could rub an ulcer. But I don't feel it. But it could rub an ulcer that does not heal. So always, and the hand is going to be more sensitive. So put your hands in there and just feel it. It'll become a habit. You won't have to even think about it. And make sure there's no. We had one person that did that because when they put it in there, they felt a nail. And then they looked at the bottom of their foot, and that nail had been through their foot. They never felt it. But when they put their hand in the shoe, they saw it, and it had come through. How did they find out that it was a problem? Because when they took their shoe off, they smelled something. I don't mean like just a bad foot odor. It was the odor of infection. And they had stepped on a nail, continued wearing the shoe, did not know it, and it had gone up into his heel, gotten infected, and not until he could smell the infection did he seek treatment. He lost part of his foot. Now, all of that to say, if he'd just looked at his feet every day, but he just washed and went. And he told it. He was 30 years old. But we saved his leg. Okay, so look in your shoes. Make sure you look at the, and make sure the shoes are not, I get on to women about this, you don't have to get in that half a size smaller. You always, if your feet are two different sizes, wear the larger size shoe if you're going to buy it, you know. So make sure, and then make sure that in trimming your nails, that you're very careful at the corners. You know, we say cut straight across. I know people try to do all sorts of things, but it's really important that you don't cut them to the point that they can get ingrown. Diabetics are more prone to have ingrown nails. We had someone here at the church last week that had to have their full big toe nail removed because it was so ingrown. So it's just, you know, it's important to keep them trimmed appropriately and to watch and see if they start getting ingrown, okay? Now, I want the camera just to show this. I've got some extra points that are not on your handout that I want you to mark on your handout. But here, these are 9 places that we'll check later. We see the 3 toes, the 3, which almost like a triangle, 1 on each side. This one I don't think I have marked, so if you will right now mark that on your foot example, because that's what we'll use later in this class. 1 at the heel. And then if I were to turn the foot over, I had 1 foot model I was going to bring, but it had a horrible ulcer on it, and I was afraid that you might make you sick. But right at the top of the foot, I'm going to show you how to check there. So we're going to check the top of the foot in 1 spot. Now, some tests on this monofilament will only do 5 points. We're a little aggressive, but this is one that's put out by the American Diabetic Association. So, but the point is checking areas, and you might have a heavy callus here. And you'll know the person that's doing the test, if they see that it's so leathery there, there's no way that anybody could feel anything, you'd go to the side of that. Or some people next to their big toe or little toe, where if they pronate or supinate, they may develop a callus there. So you work around that, because you know, anybody wouldn't be able to feel that. Okay, so we'll refer back to this a little bit later, but these are points we check. This is an issue if your foot, and this is orthopedic. I've only known 1 person at our church that this happened to while I knew them. And the foot literally, the bones deteriorate and it drops. And this is something, I have some pictures in your literature, it would need immediate attention. Because if you let that stay like that, you'll have some obviously permanent damage on that. And then in between your toes, this is what I said, how can you tell the difference if that's just athlete's foot? Or if you've got a skin fungus, which is basically the same thing. Or is it something where I've gotten so dry that it's broken down and split, but it's not infected yet? Y'all, a lot of this looks the same. So when you notice changes, it should be nothing. It should be good skin, not dry. The beginning of the breakdown of the skin, it gets dry and flaky. And then it'll stage down, it'll start cracking. And you can get in a problem there, and it goes down, and here it's actually developed some infection. So again, feet are so important for you to be familiar with. Taking care of them every day, make sure your shoes fit well. And if you do have a breakdown, do not wear colored socks. If you have a breakdown, often that wound can be irritated by the color and the dye. So if you have a wound, and again, it's only the part that's down, it's okay if the color is above, but where the wound is, it needs to be white. There's actually socks that the part that's in the shoe is white and the other part can be colored, so no one else knows that you have a white part. But be very careful. An area that's broken down, the color dye can be very irritating. Okay, just as the skin infection on my feet, if your sugar is not controlled, can get fungal infections. Remember, we can get a fungal infection in our tongue. Women, you're going to be more apt to have yeast infections as well. And the higher the sugar, the more trips you're going to make to the pharmacy. So yeast infections are very, very common in diabetics and very much need to be controlled. Okay, so we're going to look at diabetic shoes. I'm not supporting a particular store. I'm just going to name, just so you'll have a couple. I call both of these. Do you have diabetic shoes? Will you accept the prescription, the order? Because as a diabetic, your doctor can give you a prescription. You can get a new pair every year. You know that, don't you? And you need to take advantage of that because that's what your insurance is for. Do they have shoes that you can wear to church? Yes. They have an athletic shoe, meaning something if you want to walk. I encourage walking. They have one that's good for that, the way it's supported, the way it does. The shoe box, which is the front, is built a little bit wider. And I said, well, do you have something that doesn't look clunky? Because I know the girls are going to say, I can't wear that to church. They do have, so here's two stores. There is a Homewood location for both, and then Shoe Inn also has a Hoover location. I think it's a little bit larger, the selection. But I looked even at some of the men's shoes. They had some that were stylish that you could wear with, a sport coat and other things. So just bear that in mind. If I was diabetic, I would make sure I took advantage and got me one free pair of diabetic shoes a year. Just FYI. Okay. Excuse me, know your numbers. Most of you do. But I want you to be very, very aware of what your numbers should be. Now, you're going to flick through your handouts because I had some information about neuropathy. Again, a lot of homework for y'all to do, but if you're going to be knowledgeable about your disease. But know your numbers. The A1C, and this is what you hear. This is a 1, A1C. You're going to hear that a lot. Used to be 40 years ago, and I'm at the age, when I got out of nursing school, it was 40 plus years ago, we didn't, A1C, what is that? We were talking about just your fasting glucose. And we did some urine tests and some other things. But A1C will give you an average of what your glucose has been running for 3 months. Very, very valuable. You need to know what yours is. And you need to celebrate when it's a good number. We'll go over that in a second. You need to know what your blood pressure is because diabetics will have a tendency for the blood pressure to begin going up. And especially if you develop cardiovascular disease. Know what your number is. Check it on occasion. And then know your cholesterol. That's not just total cholesterol. You need to know what is your LDL cholesterol. Very important. That is a sticky type of cholesterol that will stick to the artery, and that can be your culprit. LDL. It has a long name. I call it L lousy or L lethal. You want to know what your LDL is. And then HDL cholesterol, again, it's part of your cholesterol. HDL is very protective. LDL, if it's bad for me, I want it as low as I can get. If HDL is good for me, I want it as high as I can get. Men need it above 40. Women need it above 50. HDL. LDLs, it depends if you already have been diagnosed with heart disease. But LDL, you want, now I'll give numbers, but based on findings, I'd like my LDL, if I'm doing great in great health, less than 120. We ask for it to be less than 100. If you have heart disease, less than 70. Very hard to get without medication. So these are very important things. Why? Because we used to do a formula. I worked in cardiology for 20 years at a hospital, and we do a formula. If you were diabetic, if you had any other risk factor, what do you mean? Well, if you're diabetic and have hypertension, Well, how about another one? If you were diabetic, have hypertension, and have high cholesterol, ooh, it's like rolling, the wheel. The percentage gets higher and higher of having a vessel problem. So what do? Control them. Keep your sugar tight control. Keep your blood pressure really under tight control, and your total lipid profile, cholesterol, HDL, LDL, under tight control. And then you can push away these complications. But it's important, these three things, that you keep under tight control. What does that mean? Now, one of these is the American Dietetic Association. This is going to be, I can't now remember what that stands for. Wait just a second. I'll make sure I have it for here. The Association of Clinical Endocrinologists. Okay, and that's not something I say often, but the AAC is Association of, in America, of Clinical Endocrinologists, and the other would be dietitians. They're a little bit different numbers, and that's why I say that. What do they recommend? For the A1C, one says 7% or less, one says 6.5. Endocrinologists, so I'm kind of pushing with the 6.5 or less. So blood pressure, okay, well, 140, get less than 140 over 90. But if you talk to people now, we're seeing it's better the lower. It's better the lower. And I've had so many doctors say, oh, but that's been their normal for 20 years. Well, what that means is for 20 years it's messed up their blood vessels. Just because it's the way they are used to it doesn't mean it's right. I can put a rock in my shoe and walk on it. Well, I had it in there for 20 years. Does it mean it's right? No. Does it mean I can do something about it? Yeah, I can take the rock out. Just because I've had it for many, many years doesn't mean it's right and that I can't do anything with it. So even though you've had a high blood pressure for years, don't think that it can't be changed. And the LDL, remember I said this is the bad culprit. The 120 used to be what we'd medicate you with. But this is the numbers to look for. If you do not have heart disease, try to get it 100. Well, if you have heart disease, well, you're diabetic, so you want to be really protective. 70 is your target go, and then they even try to get down to 50. And again, it's hard to see people doing that. But very, very important. I hope I'm giving you so much information. I know that you'll have to refer back to this. Here's more glycemic controls, and this was based on 2 years ago. But it'll give you goals and numbers to shoot for. I won't spend any time, but that's in your handout. Criteria for diagnosis, most of you have already got the diagnosis, so I don't have to tell you what that is. And then I put this up, and we did a little projection. If it's 3 months and an A1C comes back a certain number, what would that compare to your blood glucose? In other words, what would have been an average of my blood glucose for 3 months? So if you had an A1C of 6, that means your average glucose over 3 months was 126. So can you see how you want it, as low as possible? But look at some of these numbers as it goes up. So complications as they rise, very important. So tests you need. All of this is in your packet. Quick, go through it. A complete eye exam. If you have some issues, at least twice a year. A foot exam, once to twice a year. The lipids, this is your lipids, the cholesterol, LDL, and the triglycerides. And why the triglycerides? Triglycerides slide often with diabetics. When we used to do the lab work, and every alcoholic that came through that I tested had high triglycerides, and also they had a high level of incidence of diabetes. So what you'll find is often this slides together. So when your sugar starts going up, and alcohol have a lot of sugar, when the sugar starts going up, we often see rise in triglycerides too. Triglycerides alone can be an issue with your blood vessels. So that is another thing they'll test. We look for protein in your urine, and the reason being we're trying to make sure your kidneys continue optimal function. When protein starts spilling off into the urine, the doctor really needs to take a look and keep a close eye of your kidneys. So, and creatinine, the GFR, these are all tests doing. And then we also want to check the thyroid stimulating hormone, especially for women, especially over the age of 50. Some of us in here, like myself, are. And also if your cholesterol is teetering above a certain number. Why? And I'm going to have a program on this in 2018, I promise. But we're finding more and more women are having hypothyroidism. There's probably several in here. And we're finding that those that do, we really keep an eye on them for developing diabetes. And then we're looking as well as how does that parallel with cholesterol. There's still so much we don't know. But y'all, there's far more hypothyroidism in this world today than we had diagnosed, decades ago. There is. It's not just that we're testing it more often, we're seeing it more often. Because if you're hypothyroid, you have the symptoms. How does it parallel with diabetes? So all of you in here, women in particular, but should have their thyroid examined. Liver function test, and then of course dental exam. These are tests that in your booklet. Now what I've done is in my phone I have electronic testing things, so I keep a record of when is it time for my bone density, when is it time for my mammogram, and I keep it listed and the date that I got it and the results. We should do that for any tests on that, and then that way, because y'all, it's easy to forget and let it slip up on you. Oh my gosh, I haven't had my eyes checked in. Can't do that if you're diabetic. So find a way best for you. Some of you are electronic savvy, some are not. If it's paper, do it, but find some way best for you that you'll keep a record and know when to come in and get your exams. Can I exercise? Absolutely. There's some great articles about this, but this is what you need to know. You don't have to write it down. It'll be in your handout. But if you check your glucose, and everybody should have an apparatus to check their blood sugar. If it is less than 100, you need to have one of those snacks before 15 grams of carbs before you exercise. Does everybody understand that? If not, the potential for you dropping too low during exercise is high. Okay, so if your sugar is between 100 and 250, it's okay to go ahead and do your exercise. If it's greater than 250, this is a crazy thing. It's the way our body's designed. But if it's greater than 250, you need to check and see if there's been any spillage of ketones in your urine, because that usually can be an issue. And you will find, crazy, you'll find that your sugar will actually go up rather than down. And so, go down rather than up. So if your blood sugar is high, check your urine. If they're ketones, do not exercise. Everybody hear that? If there's ketones in your urine, do not exercise. The exercise will drop your sugar more. Sounds weird, doesn't it? But that's the way our body works, so we got to be really careful on that until we get the sugar back in whack. If the blood sugar drops below 70, if you feel shaky and weak, confused, well then, and a lot of people, when they get confused, they don't check the sugar, but you need to take the 15 grams of carb. I've already mentioned the liquid is great. This is something good I'd keep in my exercise bag. You don't always have your snacks around, okay? So 15 grams of carb, recheck in 15 minutes. That 15 grams of quick carb in 15 minutes should boost up your sugar. Recheck it before you exercise. I'm just giving you safety parameters here. Repeat until it gets at least 60. I'm not going to go all over this. You have them in your handout, but you need to know, your loved ones, your friends need to know the symptoms of low sugar. Now, typically, if you have already the diagnosis of diabetes, the sugar going up is not going to be the instant that probably will take you in. It can. You can get in a diabetic crisis at too high, but most often we get in a crisis because it dropped too low. So you need to know those symptoms. The ones I would highlight the most, they get a cold, sweaty, and they can get where literally the personality changes. They can get irritable. And so the shakiness, sweaty, chills, and clamminess is classic for the sugar dropping low. Clumsy, lightheaded, and then all of these go on. Some of these you think, well, that's just a normal day for me. But if it gets too low, they will lose the ability to swallow. So you need to check their glucose and make sure that you can get their carbs in and get their sugar back up while they can still swallow. If not, it's a 911 call. I cannot tell you the number of diabetics within our own church congregation that I've had to treat. We didn't have to dial 911. It got the sugar up. We rechecked it, and they're ready to go back and teach Sunday school. But if you wait too long, it's going to be something that you cannot swallow. And that's happened one time. They didn't call for us until it got too late. And then I had to call 911, and the sugar they got had to be through their vein. So, but at home, you can do this. You can do this. So know these symptoms. The loved ones, tell them what, so they know what to expect, and they'll know the symptoms well. If they have ongoing hyper, too high, again, the wounds won't heal. I've already talked about fungal infections, vision changes, nerve damage, the feet changing, the hair on the legs changing, erectile dysfunction, stomach and intestinal problems. We've gone over all of these. These are just visual examples. I wanted to add that to your handout to be a good reminder of hypoglycemia, to know to check it and treat it. Does everybody in here have a glucometer, something to check their glucose? Okay, if not, then after class you can talk to me about that. Everyone should have the ID card. If you have a necklace or bracelets, that's okay, but at least a card in your billfold. Because most people, if you're driving, you have to have a billfold with your license. And put it near your license so we can see it, okay? And what you can do. And so far in this course, we talked about nutrition. That is something actively and one of the most impactful things you can do. Choosing what you eat or don't eat. And we'll still have availability to make an appointment, I hope. Weight control, the more you are overweight, the more it's challenging to control your glucose. So exercising regularly. But Debbie, you just don't know how bad my feet feel. You don't know how I have neuropathy and I'm afraid I'm going to stumble or fall. Well, we need to work around that and try to get some type of exercise program that would work for you. It's going to help control the blood sugar. Getting control of the LDL, and if you do everything you can with your diet, every single thing, and you've cut down, you've lost weight, you've done everything, you're exercising, and the LDL still stays up, I would encourage you to still have that conversation with your doctor about a medication. I don't encourage that often, but if you're a diabetic and if you're doing everything you can diet-wise, and you have exercised and it's not budging the LDL, it's critical that you get that under control. And of course, the other things we've already mentioned. There are a lot. All of these had diabetes, so some of them I didn't know about. I didn't know Sharon Stone was a diabetic or Larry King. But there are some very famous people that have diabetes, and a lot of these are living very well with diabetes. You would never know it. They are high functioning with their work. They are, we have athletes that are diabetics, but y'all, they have taken control of their diabetes. They've learned to live with it. So you can do that too. You can live, you can thrive with the diagnosis of diabetes as long as you follow some great tips. I thank you for being here this evening, and I hope that next time I see you, you're going to be telling me how much better you feel. Thank you.